welcome to the Health Show. My name is Sal DeBella, and I'm your host. Today we have Dr. Linda Issacs with us. She's been on our show previously, and I've gotten so many emails asking to have her back again and to ask her different questions that I took down and I'm going to ask her. So welcome, Dr. Issacs.
Well, thank you so much. It's great to be here.
Thank you so much. So we're going to get into this right away so we can cover a lot of the things that people want to know. Dr. Issacs worked with Dr. Nicholas Gonzalez for many years. And these are the protocols of what they use. Food as a foundation, proper supplementation, and detoxification protocols. So, can you tell our new viewers a little bit about your background and your credentials?
Sure. I went to medical school at Vanderbilt University. In fact, I just recently went to one of my reunions and had a wonderful time. Vanderbilt was a great school to attend. I then finished my residency in internal medicine here in New York City, and I am board certified in internal medicine. I've actually re-credentialed several times now, the most recently in 2011. And I worked with Dr. Nicholas Gonzalez as soon as I came out of my residency. I had actually met him while we were both at Vanderbilt. He did his internship there, and we were assigned to work on the same internal medicine team when I was a third-year medical student. So I spent 6 weeks working with him and learned a lot about the research project that he was engaged in at that time. That led me, through various events afterwards to decide that this is what I wanted to do with my life. And so I came to join him when I finished my residency, and I was working with him ever since. So that was in 1991, I believe it was. So he and I worked together in the same office up until he passed away last year.
Okay. Now, Dr. Gonzalez's widow has published the first of 2 volumes of cases that Dr. Gonzalez was working on. What is the name of the book and where could you get it, firstly? And then secondly, can we talk a little bit about those cases?
Well, sure. The title that Mrs. Gonzalez chose to give the book is Conquering Cancer, and it's going to be put out in 2 volumes. Nick was working on this at the time of his death. He'd actually been working on it for a few years, so it was a big project, a very big project. And the book is, just because he was still working on it, there was a lot of minor editorial additions that she had to make. And it was a big project for her. I have to give her a lot of credit for making it all happen. Myself, I was mainly busy just keeping the practice together and taking over his patients and et cetera. The first volume contains 50 cases altogether, and they're made up of cases with either pancreatic cancer or breast cancer. Volume 2 is going to have more cases of a variety of different other types of cancer. And I believe that she's planning to bring that out sometime next year. So in terms of the cases in the current volume, it's pancreatic cancer and breast cancer. And what these cases would represent would be people with clear-cut active disease who had done well on this protocol. So people, in other words, with remarkable stories from a medical point of view. The book is available from Amazon. That's going to be the place where a person can get it. And they can either look up Nicholas Gonzalez, who's the author, or the title, Conquering Cancer. Okay. Now, do you have any knowledge? Did you read the book, and do you know the cases that's in there? Well, many of the cases, of course, are familiar to me just because of years working in the same office. So, in the case of people that he treated, I'm already familiar with many of them, partly because some of those cases had been written up before in articles that are available. And many of those are actually available on my website at drlindai.com/articles. People can find that information. But some of the cases are, of course, patients that I was the treating physician, and so those are going to be the ones that I'm most familiar with. As an example, a patient of mine who was diagnosed with pancreatic cancer in late in the year 2000. She had actually had a little bit of weight loss and a little bit of abdominal discomfort. She went to see her doctor, and I have to give a lot of credit to the doctor. There's many doctors that would have just patted her on the head and told her she was depressed, but this doctor got a CAT scan immediately, and she was found to have a tumor in the pancreas that was biopsied and confirmed to be the aggressive type of pancreatic cancer. That biopsy was also reviewed at an outside hospital at the Mayo Clinic, actually. They got confirmation from another set of doctors that she did indeed have cancer. The only kind of treatment that she's gotten is treatment with me. She started in, I believe it was April in the year 2001, and she is still alive. In fact, I saw her a few weeks ago at a conference where she and I were both presenters, and she is now, what I guess that would make her 15 years out with a diagnosis where 15 months would be remarkable and 15 weeks might be fairly typical. So she is still alive and with us 15 years out, looks great, and is engaged in various activities trying to help other people to realize that there are alternatives to standard treatment. So she is one of the cases in that book.
Okay. Now, how old was she when she developed the disease?
Well, that's a good question, and I think she was in her mid-50s, but I'm not sure exactly.
Do people usually get pancreatic cancer later in their life, in their 50s?
It's usually a disease that comes about as people get older. So I've seen patients anywhere from probably the youngest would be in their mid-40s up until, I've seen people as old as in their early 80s with that illness. So sure, it's a disease that typically occurs later in life.
Uh-huh. Now, what about breast cancer? You've been helping people also with breast cancer. Is the treatment the same for breast cancer than it is for pancreatic cancer?
Well, the treatment that we offer is always going to be slightly different from one patient to the next, just because there is an element of individualization to it. But for those two illnesses, there are a lot of similarities as well. Both diagnoses, we typically would advise people to eat a diet that's more on the vegetarian side, although there would be some eggs, some dairy if they tolerate it. Some people don't tolerate dairy, but if the patients tolerate it, they can have it. Some fish, but no red meat or poultry, typically for both of those diagnoses. And the supplement would be tending towards more magnesium and potassium, less calcium, but always a lot of pancreatic enzymes, which we feel are the backbone of what we do in the treatment of cancer. So there would be a lot of similarities, yes, between the treatment of those two illnesses.
Okay. Now, I was listening to a lecture that Dr. Gonzalez gave before his passing. I think it was his last lecture. He spoke for about 3 hours, and he talked about a patient. He spoke about when he sees a patient for the first time. Through his experience, he can tell what type of diet they should be on. To his so many years of experience, he was saying. But the testing, he also spoke about was blood work and hair tests, clinical signs, personality and lifestyle. And he talked about 10 basic diets. Can we talk about these diets? Plant-based diet, Mediterranean diet, animal-based diet, and a variety of nutritions?
Well, the theoretical underpinnings for all of this can take quite a while to describe, and what I'm thinking is to just give you a short version right now, since I don't know how much time of the limited time we have you want to spend on this topic. The theoretical underpinnings tie into what's called the autonomic nervous system. That's what controls the functions of our body that we don't have to consciously think about. You don't have to remind your heart to beat. You don't have to remind your stomach to digest food. Those things just happen, but they are under nervous control, and that's the autonomic nervous system. It has two parts, the sympathetic and the parasympathetic. The sympathetic is involved in the stress response system. And so when the sympathetic system fires, it helps us respond to stress. And so it speeds up the heart and raises the blood pressure. But it tends to tell the digestion to slow down, to stop. Because if you're about to get hit by a bus, digesting your lunch can wait until later. The parasympathetic system stimulates the digestive system, but because it's the rest and digest system, so it puts you in rest mode. And so the parasympathetic system stimulates the digestive system, but it slows down the heart and lowers the blood pressure. The reason this is relevant to the question you just asked me is because we believe, and other practitioners and scientists before us have believed, that different people have either a strong sympathetic system or a strong parasympathetic system. And because of the impact of those systems on the digestive tract, the foods that those people need will be different. The sympathetic dominant, whose nervous system is constantly telling the gut, slow down, stop, not now, we're responding to stress, those people typically don't do well with a lot of protein and fat in the diet because that takes more concentrated energy to digest. They typically do well with a lot of carbohydrates or foods that burn more quickly, so to speak. The other group of people, the people whose parasympathetic system is overactive, their digestive system is extremely efficient, and those people actually need the slower burning fuels like protein and fat to feel well and to do better. Giving them a lot of carbohydrates just gives them a quick energy burst followed by nothing. So it's like throwing kindling on a fire. You get poof and then nothing. And so those people can have ups and downs of energy all day long if they eat a lot of carbohydrates. Those people typically need slow burning fuels. So then there's people that exist in between those two extremes, and those people can do well with a variety of different types of foods. The other variable in this is how efficient somebody's system is. There are some people who operate at very high efficiency, and they do well with a lot of raw foods. There's people whose gut is very inefficient, and they do better with more cooked foods. So between the variables of how sympathetic versus parasympathetic somebody is and how efficient they are, that's how our predecessor in this work, Dr. Kelly, got 10 basic diets, and that's the general structure that we've continued to follow because we found that it works quite well for the vast majority of the patients that we see. If you can figure out where they need to be on the spectrum and give them the right diet, and along with that, the right supplements, then you can help them improve their health.
Okay. So is it true to say that solid tumors, people with solid tumors, would be on a plant-based diet more than meat?
Generally speaking, that's correct. What we believe is that patients whose diagnosis includes the word carcinoma, and that would be lung cancer, breast cancer, pancreatic cancer, prostate cancer, colon cancer, the major cancers, really. Those types of cancers, typically those patients will do best on a more plant-based diet. The patients that typically need a lot of meat in their diet are the ones with the blood-based cancer, so to speak. So that would be leukemias, lymphomas. It would also be melanoma and sarcomas as well. And then there are some patients whose metabolism can be a little more balanced, and yet they might develop cancer. Usually that means their system must be inefficient, because usually people that are fairly balanced are also pretty healthy.
Now, the diet for the people, say with leukemia or melanoma, now they're going to eat meat. What does their diet look like per day? Meat every day, is that it?
They would eat some form of animal protein every day, and that might be red meat, it might be poultry, it might be fish. We give them at least I give them a certain amount of latitude because, honestly, with the exception of sugar, which most of us love and none of us should eat, most people are attracted to the food that's good for them, I believe. And so if somebody is truly craving eating red meat 3 times a day, that is probably exactly what their body needs to do. So if they want to eat roast beef for breakfast, that's perfectly okay. And many times patients whose metabolism is that extreme would be people that would do well on, in effect, a meat and vegetables kind of diet. In other words, they would eat root vegetables, things like beets or carrots, for example, or broccoli, Brussels sprouts, those types of things, and a lot of animal protein, and that would serve them very, very well. The people of the opposite extreme would be eating a lot of a wide variety of different vegetables, things like leafy greens and eggs and fish, but not a lot of red meat. Most of the time, a person who definitely needs to eat the more vegetarian diet, when they do eat red meat, they don't feel well. Their digestive system really can't handle it, and they feel like they've eaten a brick. Whereas most of the time, the people with the type of metabolism that needs a lot of animal protein, when they come in, especially if they've been trying to put themselves on a vegetarian diet thinking that was best, when I tell them they can eat red meat, they look like they have had the answer to their prayers. They're so happy. If I was to try to eat red meat 3 times a day, I would feel sick, but that's not my metabolism.
Mm-hmm. Okay, now, as far as fruit, what is the diet that'll take the fruit? Is it the meat or the plant-based diet for the fruit?
Well, it depends on the fruit to some extent, because some fruits tend to be they make the body more alkaline. That's plant-based diets are also alkalinizing. Whereas the people that need to be eating a lot of red meat, those people are already too alkaline by nature. They need to get more acid. So citrus is probably the best example of an alkalinizing fruit. Many times people are puzzled by that because when you think of citrus, you think of acid. It tastes acid in your mouth. But citric acid goes straight into the energy pathways in the body and is immediately burned. What's left over if you burn a grapefruit, so to speak, is actually rather alkalinizing. So the people that need a lot of red meat typically don't do well with a lot of citrus. And there again, many times I'll ask those people, or I'll tell them citrus really isn't the best food for you, and they'll say, well, I don't like it anyway. Makes sense. But having said that, you'd asked about fruit in general, and the people with the extremely carnivorous metabolism, sometimes fruit for them is a little too much of a sugar load. They would get a burst of energy and then a flattening out again. But if they tolerate it well, things like bananas, for example, or apples or berries, especially, they can do well with. And the tropical fruits like mango or pineapple, many people actually do very well with those because they have a lot of useful anti-inflammatory enzymes. So it depends on the fruit and it depends on the person, basically.
Right. There's a lot of people that are afraid with cancer on a diet, afraid to eat the fruit because of the sugar. So can you explain why it's not as harmful to eat the fruit?
Well, the argument about cancer and sugar, again, there's a very elaborate reason why people say that that's an issue. What I can tell you is that Dr. Gonzalez and those case books describes 50 cases of people that have done extraordinarily well while eating the fruit. So, to me, that's a pretty good argument right there for eating fruit. But what I would say also is that if somebody has blood sugar issues where their blood sugar is chronically running very, very high, and I'm talking about outside of the normal range from a laboratory, well then sure, that person should be cautious about eating fruit. But for most people, eating fruit is not going to raise their blood pressure to a point their blood sugar, where it's going to make any major difference as far as the cancer goes. Your body works very hard to maintain your blood sugar in a certain narrow range because there's a lot of important organs like the brain that requires some blood sugar. So it's really, I believe, impossible to get your blood sugar low enough to make any difference to that cancer. And it's very unlikely that your average person is going to raise their blood pressure by eating an apple, for example, enough to make any difference to the cancer whatsoever.
Right. Well, on some diets, like the Gerson diet, they talk about drinking carrot juice. I drink carrot juice every day, and I think it could be very beneficial for people in general. But they drink, I think even Dr. Gonzalez was talking about also carrot juice. I'm almost sure that it's a good, and that has sugar in it also, right?
That's right. There are some people currently, the whole cancer feeds on sugar thing is very much in vogue right at the moment. There doesn't seem to be a whole lot of persuasive data in terms of patient outcomes to support the idea that people need to be draconian about getting rid of anything that remotely looks like a carbohydrate in their diet. Our patients are routinely told to drink 4 glasses of carrot juice a day, or vegetable juice, predominantly carrot. And again, I have patients like this patient I told you about just a little while ago. She's 15 years out and she's been drinking carrot juice the whole time, with an illness that should have killed her in the early 2000s. So I think that that's the best argument I can have for saying that, yes, carrot juice is perfectly fine for cancer patients, and I think very beneficial.
Now, you're a doctor, an MD, and you're a woman. God forbid you came up with breast cancer. What would be the first steps, or what would be the steps that you would take to get rid of that cancer?
Well, given what I do, of course, I would immediately put myself on a high-dose enzyme protocol. Now, I'm not on that right now. I do my own program. I take supplements. I follow the diet. I eat organically. I do various detoxification things. All the things that I tell my patients to do, I do. But I don't take high doses of pancreatic enzymes at the current time because I don't have any kind of illness that requires that I do so. But having said that, I suppose, honestly, I do believe that surgery has a role in the treatment of cancer. And I think that for early stage breast cancer, there's no question that surgery can be beneficial. I know that perhaps some of your other interviewees or some of your audience might be surprised to hear me say that, but the reality is surgery can be beneficial. If I found a breast lump, I would get it out, bottom line. But I would also modify my own protocol to include a lot of pancreatic enzymes. I would do both.
Well, I'm happy you said that, because a doctor had asked me, he said, you've interviewed like over 50 doctors. Now, what you've learned between doing that, and I wrote a book, and I have ideas about what people, I think, should do. So he asked me, what would you do if a loved one had breast cancer? So, I thought about that for a minute, and then I said, what I would do is, it's right there. It's not that you got to move 100 organs out of the way to get to it. I would take it out and then deal with what might be in your body after that, So it makes sense to me because I believe that not only could people be healed with what they eat and what supplements they take and how they live their lifestyle, but I believe surgery, if it's done right, see, that's another thing. If it's done right and they take more of the tissue and do not disturb the tumor, then I think you have a tremendous chance of long-term survival. I really, really believe that. But then again, you have to do your homework. You have to research doctors. Like what I heard at Sloan Kettering, they do have doctors that do take away a lot more of the tissue and not disturb the actual tumor. Because I believe once you do that, then you might be in trouble if you disturb the tumor. But I'm happy that you mentioned that. That I agree with you 100%. It does have a place.
Yeah, it does. It does have a place, and sometimes my office is contacted by people who feel very strongly that they don't want to have a tumor out. But again, it just, to me, it makes sense. And there are some situations, like for instance, colon cancer is another one where we'll get contacted by people that don't want to get the tumor out. But in some cases, the tumor is bleeding. It's causing anemia. It's causing digestive problems like low-grade blockage, and in all of these cases it just seems like the body would work so much better to just go ahead and get that thing out. I understand that having surgery is, it's not something that anybody wants to do, for no good reason, but these are all very good reasons to go ahead and deal with something. So that's something I feel pretty strongly about.
Okay. Now, can we talk a little bit about the supplements? Now, the people that have a solid tumor, do they get the same supplements, and they are on a plant-based diet, do they get the same supplements that a person that's eating red meat, say like on a blood disease type of cancer?
No, they wouldn't. We have a spectrum of different types of supplements, just as we have a spectrum of different types of diets. The reason being that the people that are on the plant-based diet typically do well with quite a lot of magnesium and potassium and very little calcium. And then the people on the other end of the spectrum, the meat eaters, we believe do well with calcium, but very little magnesium and potassium. There's also variation medications and how much of the B vitamins we might give people, which B vitamins. There's another spectrum involved with that, so to speak. And so we have, what we have are 4 different formulations of multimineral and multivitamin. And then we have smaller sized supplements that we use in addition. Sometimes people will be surprised by how many different little pills they might take on this protocol, but that's how we individualize things. So, one person with pancreatic cancer, for example, might be on a number of additional little magnesiums in addition to their multimineral, and another patient might be on slightly less. That's how we manage to individualize things without having, one multimineral that's the Sal de Bella multimineral. That would just make it prohibitively expensive. So instead, we have 4 basic formulations, and then we add additional things to that using smaller building blocks.
Okay, so say a man has a prostate cancer, or a woman has breast cancer, which is a tumor, a solid tumor. What would they be taking? Turmeric, glutathione, and a number of other things like that? I mean, could you name some?
Well, for instance, with turmeric, currently I've been recommending a curcumin product, curcumin being the main anti-inflammatory in turmeric. So I do use that with some of the patients. As far as glutathione, I've been using alpha-lipoic acid and N-acetylcysteine, which is a way to help encourage the body to make more glutathione. So many of those things can be useful, but the backbone of what we do for cancer is really pancreatic enzymes and the multimineral and multivitamin type formulations that help adjust autonomic physiology so that the body will work better. And we got very good results. Our predecessor in this work, Dr. Kelly, got very good results really with a fairly simple protocol. Some of these newer things can definitely be helpful. I'm not saying they're not, but it's not the backbone of what we do.
Okay, can you explain to the people that don't know what pancreatic enzymes are?
Sure. The pancreas is an organ in the body that it actually has different types of functions. The pancreas is almost like 2 organs in one. They have cells that make things like insulin that manage blood sugar, but there are also a different group of cells that make pancreatic enzymes. And enzymes are things that help your body get things done, basically. They create different kinds of reactions. In the case of pancreatic enzymes, they're secreted and then wind up in the intestinal tract to help digest food. It's believed in the regular medical literature that that's their only function. But in fact, you can find pancreatic enzymes in the bloodstream, but many people never seem to wonder why they're there in the first place. But it turns out that enzymes have a lot of different roles in the body as a whole, in addition to the digestive tract. The use of pancreatic enzymes in dealing with cancer actually goes back more than 100 years. There was a scientist named Dr. Beard, who was a scientist at the University of Edinburgh, and he had devised a rationale for why pancreatic enzymes might be useful against cancer. Many doctors at that time went ahead and tried them out with some very good results, but it's something that has really, in my opinion, never been formally tested well enough in the orthodox medical literature to demonstrate that it can be effective. Practitioners like Dr. Kelly, our predecessor in this work, who used enzymes against cancer, and then Dr. Gonzalez and myself, we've generated quite a lot of very compelling stories of people that have done well with it.
Now, how many milligrams or how often should you be taking this? And for how long?
Yeah, that starts to get a little tricky because, my giving you specific recommendations, in the medical world and especially in the litigious American medical world, one of your viewers might decide that they're going to figure out how to do this for themselves and get into trouble.
That would be
Um,
wrong. That
yeah, they
would be
shouldn't. They shouldn't do
not a
that.
good thing
But
to do.
yeah, that would not be a smart thing to
No.
do. But our patients will wind up taking in the neighborhood of 100 capsules a day of pancreatic enzymes. We tell people ahead of time that they're going to be taking 150 to 200 pills a day.
Wow.
Some of them they take with their meals, but the pancreatic enzymes are taken away from meals, and they might be taking in the neighborhood of 100 capsules just of that.
Wow. That sounds like a lot of capsules. Now,
Well, it is a lot of capsules, and I guess what I'd say though, because they are capsules, many people find those easier to swallow. But this is not a good program for somebody that just really has a hard time getting pills down. It's one of the questions we ask people before they make appointments.
are they big? Are they small?
I don't know how to answer that one. They're certainly not as big as your average fish oil capsule, which
Okay.
looks like a bit of a horse pill.
Right.
So I would say medium size.
Okay. Okay. So, and how long would you say, for how many years would they have to continue?
Well, Dr. Kelly, our predecessor in this work, apparently used to tell people that they needed to do their program as long as they wanted to feel well. And what I would say, he once told me that it takes between 4 and 7 years to repair a body. And that seems to be pretty much my experience in terms of dealing with patients. Now, many of our patients do continue on a modified protocol indefinitely. I've seen some patients of Dr. Gonzalez that are 25 years out. Like for instance, I've seen one of the patients with breast cancer that's described in the book that we talked about earlier. She is still on her protocol all of these years later because she knows that there must have been something going on with her system to have gotten cancer in the first place. And so she feels that it's important to keep taking pancreatic enzymes indefinitely. To me, that makes perfect sense.
Right. Now, can we talk a little bit about the detoxification, the coffee enemas, and is there anything other than coffee enemas that you use?
Well, yes. Coffee enemas on a day-to-day basis are the backbone of the detoxification efforts, but there's a lot of ways to get waste materials out of the body. One of the things that we have people do is a liver gallbladder flush, and that's something that they would do. It takes about 5 days to do it, and they do that once every 3 months or so. So that's a procedure that involves, at one point, drinking a large amount of olive oil. It's something that I've done myself. In fact, I did one just a week or two ago, and it's something that can help keep the liver and gallbladder working at peak efficiency from my point of view. There's procedures that help clear out the intestinal tract a bit. There's also things that help get rid of waste through the skin. So salt and soda baths or vinegar baths, depending on the metabolism of the person doing them. I also think that infrared saunas may be a very valuable adjunct to this kind of a treatment. Really anything that helps the body move waste materials out of the system.
Right, okay. Now, what about emotions? He did talk about psychological emotions that people, if they're holding on to them, can prolong the treatment. And if you don't deal with them, it's possible that you might not have a good outcome.
Well, that is correct. And There is some information in the regular scientific literature that emotions can have a big role in health. You remember that I talked about the autonomic nervous system earlier with the sympathetic system that's involved in the stress response. Now, the sympathetic system in nature is really designed to help us deal with something that's stalking us because it wants to eat us. So looking up and seeing a tiger will definitely set off the sympathetic system. But if you think about it, if you're very angry about something, you might find your heart starts to beat faster and it jumps up in your throat and you break out in a sweat. That's all the sympathetic system turning on. Or you might, if you're feeling very sad or very frightened, you might find that you're starting to freeze up. And feeling very, very tense. Again, that's the sympathetic nervous system turning on. When that sympathetic system turns on, it puts you into a state of physiologic being where your body is focused on just getting through the next 10 minutes. It's not trying to repair and rebuild and generate long-term health. It just wants to deal with the immediate stress. If you live your life that way, if you're constantly stressed out about or angry about whatever situation or problem in your life or problem in your past, then it's very hard for your body to be able to get the resources to fix things. So people do need to deal with the emotional aspects of dealing with their situation and with their life and with their perspective towards their life. All of that is very important.
I remember years ago I read a book which got me into helping people with cancer for 25 years for free. Was a book by Dr. Carl Simonton. And he spoke about a person he had like a list of different things, like a death of a spouse, death of a child, really devastating things that could have happened to you. And I've seen it through the past, it's amazing, where a child died of a disease, of cancer, and shortly after that, maybe a year later, the father died of cancer also, being really so depressed. And I guess the immune system really depleted from the loss of a child or a spouse. And they said in the book that when you have something so devastating that happens to you and you don't deal with it, then it's very possible you can come up with a disease yourself. So I've seen it in the past with some people. So I think it's very important to, back then what I would do is make tapes. Today they're CDs, but I'd make tapes for people and teaching them how to remove the stress from their body, meditation tapes. And that helps so much by relieving the stress and anxiety from people, whether they had a loss or whether they had cancer themselves. By the way, if you're looking for any one of these DVDs of any of these shows or any of the CDs that I've made for people through the years, you can go on my website, which is thehealthshowboston.com, and pick up any of these shows, any of these doctors, any of these patients, scientists, or CDs that I've made for people like 25 years ago. It's amazing. That's helped them, because I believe you have to deal with the stress. I think it's very important, and the anxiety. I've spoken to people years ago, which was amazing, that they get a little pain here after being in remission. They get a little pain there, and right away they think the cancer is coming back. I just want to stress how important it is to go to a person like Dr. Gonzalez. Because if you're trying to do this yourself, What I've seen happen is unbelievable through the years. People try this. It takes maybe 8 years to develop cancer, in some cases. And some people, they get on a protocol, they try it, and they don't get results in a month. They jump to something else, and then they jump to something else. And that's not a good thing to do. It's very important to see a doctor like Dr. Issacs, because with her testing and with her expertise in telling you what food you should eat. Now, you might not know what food you should be eating and what you shouldn't be eating. You might think that a plant-based diet is good for everyone. But as you can hear, it's not. So this is why it's very important you get in touch with a person like Dr. Issacs, and not only would she put you on a protocol that has worked before for other patients similar to what your cancer is, but also with testing. I'm sure you do testing as you go along to see the progression of the cancer. Do you do that?
Yes, we do. But of course, the ultimate test is always how the patients are doing. And, just stepping back a moment, it really sounds like you're offering a lot of wonderful resources for the people that watch your show and the people that get your DVDs. So I think that's really great.
Thank you. Thank you. Now, what I want to end up with is prevention. What do you suggest that people do that don't have cancer? What can they do to help themselves to not have cancer?
Okay. Well, first of all, I think that diet is really the underpinning of what they can do. I realize that, in today's world, everybody's running around trying to do all sorts of things, and they cannot have time to prepare food at home, which is really the best way to eat. I realize that, but I think people need to also realize that when they cut corners in that way, they will potentially pay a price. Not only in their long-term health, but also in their short-term health. How people feel on a day-to-day basis, I think, is influenced by what they choose to eat a lot more than they might realize. So what I would recommend is that people eat whole foods, unrefined foods. So in other words, if you're going to eat grains, they should be whole grains. You want to eat fresh food, freshly prepared, as much as you possibly can. As far as things like animal protein, you want to have grass-fed products. You want to have organic. Again, as clean as possible, because there are enormous amounts of hormones and things used in the production of feedlot chickens and beef. I recently was actually speaking in a town in another state where they process a lot of chickens. And one of the people that I met there was saying that if you saw what those chickens look like as they were taking them into the plant, you would never eat chicken again. What you want are, healthy, happy chickens up until the moment that someone turned them into your dinner. You want to have animals that are properly taken care of to be the source of whatever animal protein you eat. And, to me, that's really the most important thing. After that, I would say that taking some pancreatic enzymes just to help with digestion is valuable for everybody, because when you take a few enzymes with your meals just to help you digest, that's meaning that your body doesn't have to make those enzymes, and the enzymes that your own pancreas makes can go look for abnormal cells and take care of them while there's just one or two of them. Everybody's making cancer all the time. It's your body's ability to get rid of it that helps make the difference as to whether you ever get that formal diagnosis. And I believe that pancreatic enzymes are part of the surveillance system against cancer.
Where would you get pancreatic enzymes, and how many milligrams would you take just to maintain health?
Well, the pancreas product that's available on the general market that's the closest to what Dr. Gonzalez and I use is actually made by a company called Allergy Research Group. His name is actually on the package as the designer of the product. Now, he was really meaning it more as something to help people digest. He wasn't meaning to advocate that people should be trying to self-treat cancer with it. What it is freeze-dried pancreas. It's a pancreas product, and being that it's the pancreas, it contains naturally present enzymes that can help digest food.
Okay, and how many milligrams are they?
Well, they contain 425 milligrams each, and what I take with my meals is I take 3 capsules like that with each meal, just to help me digest.
Okay. Now, if someone wanted to get in touch with you, what is your website?
My website is it's Dr. Linda I stopped trying to explain how to spell Isaacs. People seem to have issues with that. So it's DrLindaI.com. And what people will find there is a little bit more about me, some articles and things that I've written, links to some interviews like the interview you and I did earlier this year. They'll also find what to do if they want to become a patient. What I ask is that they send in some information about themselves, because I want to learn more about their situation and assess whether or not I think there's a reasonable chance that this can be of help to them. I don't want to try to treat somebody where, standard treatment can cure them, and I don't want to try to treat somebody if I don't think I can help. And so I just ask that people send in some information about themselves, and what to send and how to do it is all spelled out on my website.
Okay, and you're in Manhattan?
That's right. I'm about 3 blocks from the Empire State Building.
Okay, and your phone number?
It's 212-213-3337.
Okay. Now, we have a few minutes left. Do you accept insurance?
No, I don't. What we do is we give people forms that they can submit to their private insurance if they like, to see whether their insurance will cover it. Just because the nature of what I do is not standard medicine, that means insurance companies are not going to cover it typically. And I do not participate in Medicare or Medicaid for that reason as well. They're not going to pay enough for me to be able to pay my bills. It's just not going to happen.
Right.
So no, I'm not part of those.
Okay, I just want to mention to people that don't know out there, or maybe you don't even know this, there's a company that insures conventional medicine, and also they insure holistic medicine and alternative treatment medicine like yourself. And the name of it is O-NA, ONA, health insurance or healthcare. If you Google that, and it's reasonable, and who runs it, believe it or not, is an Indian reservation, I believe. And where I got this from is Dr. Robert Young. He was telling his patients about it. And basically they cover everything on alternative treatments. I told Dr. Brzezinski about it a while back. And I think it's a good idea that people know that if they want to go for your treatment, it could be paid for by this company. I think, I'm not sure, it's $200 and some odd a month. And it's recognized by our government. So a lot of people don't know about it, but I think you should look into it.
Okay.
And maybe put it on your website, or maybe call them and see, what you have to do to get their patients.
That's very interesting.
Is there anything else quickly in a few minutes you want to say before we close?
Well, it's always a pleasure speaking with you, and I'm certainly glad to hear that people had been contacting you with questions to ask me. I'm always happy to come back on and answer some more questions if I can.
Okay, so I thank you so much for coming back and answering these questions on the health show, and hopefully, we will get back to you again, and we'll have some other questions for you.
Okay. That sounds great.
So thank you. So there you have it, Dr. Issacs. Go to her website and check her out, ask her questions. If you have to go to a doctor. You can't do this on your own, okay? You have to go to a doctor, and she is a good choice. Ask her questions. So now, thank you for joining me on the Health Show, and we look forward to seeing you again the next time.